Okay.
So good day, my name is Maria Desreal Abduhon from BSN 1G, and today I am going to perform an assessment of the skin, hair, and nails. So the goal of this procedure is that the assessment is completed without causing anxiety or discomfort to the patient. The findings are documented, and a proper referral is made to other healthcare professionals for further evaluation. So the first thing that we need to do is to perform hand hygiene and the hair PPE if necessary to prevent the spread of microorganisms. Next is we have to identify the patient. So ma'am, can you please tell me your full name and the date of your birth?
I'm Izarina Simpa and my birthday was on October 21.
Alright, thank you so much ma'am. So now that we have identified the patient, then we will now close the curtains around the bed and the door to ensure client's privacy. And next is I will explain the procedure to the patient to ease her anxiety. So ma'am, I am Desiree and I am your student nurse for today. So I am going to assess your hair, skin, and nails to determine if you have any underlying health condition and address this as soon as possible. So do I have your permission to proceed, ma'am?
Yes.
Alright, so before proceeding, let me just ask if you have any questions. Alright, so since the patient gave us the permission to proceed and does not have any question, then I will now ask the patient to remove all clothing and change into this examination gown. So assuming that this is the examination gown, so we will instruct the patient to be in a sitting or in a relaxed sitting position for most of the times. But there are times where we have to ask the patient to be in a lying position to better assess her skin condition. So next is we have to cover exposed areas of the patient other than the one being assessed with a bath blanket or drape. Alright, so now I will begin with checking the overall skin coloration of the patient. So, so the patient have a fair skin complexion that is appropriate to her nationality and ethnic background. And the patient does not display any signs of jaundice, pallor, erythema, and cyanosis. And there is no prominent skin discoloration observed as well. So next is I will check for vascularity, bleeding, and bruising. And together with this, I will also assess or check for any presence of skin lesions. Specifically, I will check for any cuts, wounds, scratches, insect bites, and if they are present, then I will take note of their size, color, shape, order, and pattern. So the patient does not have any vascularity, bleeding, and bruising on her skin. And the skin lesions that I have observed is a flat nose on her face, hands, and feet, which is a normal finding. And also I have observed a scar on her knees, which is approximately 2 inches. So I have also observed acne marks on her face. But other than that, I haven't observed any serious primary and secondary skin lesion, and there is no open areas as well. So next is I will now assess for the temperature of the patient using my dorsum, since this part of the hands are most sensitive to temperature. Alright, so the patient is warm to touch and does not have any signs of fever or hypothermia. So next is I will now assess for the texture and moisture of the patient's skin using the palmar surface of my hands. So the patient's skin texture is smooth, and the skin of the patient is a bit moist, which is probably due to the climate that we have in our country. So next is I will assess for the skin turgor of the patient's skin. So this will help us determine if the patient is at risk of dehydration. So I will be pinching the skin under the client's clavicle. Alright, so the skin of the patient is elastic, rebounds, and it also returns to its original shape upon removing my hands from the patient's skin. So this tells us, or this helps us determine that the patient is not at risk of dehydration. So next is I will check for any signs or presence of pitting edema to the patient. So pitting edema is the accumulation of fluid. So I will use my thumb to press on the legs and ankles of the patient, as these are the common sites where edema is present. So now can I just So, the skin of the patient on her legs and ankles does not remain indented for more than 2 seconds. So, they return to their original place once the pressure is released. So, there is no edema present in the patient. So, next is I will now proceed with assessing or palpating the skin lesions of the patient using gloves. So we only palpate the skin lesions of the patient if there is, or if they are serious, or it is an open area. But since the patient has only acne marks, scars, and flat nose, then I will now proceed with assessing the nails of the patient for their color and shape, as well as their size. So the patient's nail beds is pink in color, and it does not show any signs or does not have any signs of prominent nail discoloration. There is no skin lesions, cuts, and wounds that surrounds the nails as well. So next is I will determine the shape or the angle of the patient's nails or any possible signs of nail clubbing which may indicate possibility of heart problem. So ma'am, can you please touch your index fingers together? Alright, so I could see the diamond-shaped space in between the index fingers of the patient. So this tells us that the patient's nails is 160-degree in angle, which is normal. So next is I will now assess the texture and perform a capillary refill test on the patient's nails to determine the condition of the blood flow in the patient to the patient. Alright, so the patient's nails is hard, smooth, and intact, and also while performing the capillary refill test, the pink tones under the patient's nail beds return immediately once pressure is released, which means that the blood flow of the patient is in good condition. So now, and lastly, I will now proceed with the inspection of the hair and scalp of the patient to determine if there are any lesions, masses, and tenderness on the patient's scalp, as well as presence of dandruffs, needs, and lysis. So I will be wearing a gloves. So I will now begin palpating the scalp of the patient and inspecting the patient's hair. So the patient's hair is black in color and it is not chemically colored. So the patient maintained her natural hair color. The patient's hair is also smooth and the patient's scalp is free from any masses, lesions, and tenderness as well. And there is no dandruffs, needs, and lice observed or seen so far. So the assessment of skin, hair, and nails is now done. So I will now remove my gloves and perform hand hygiene. So I will proceed with the assessment of specific body systems and document the findings and repair the findings that I have documented to other healthcare professionals for further evaluation.